Thank you. I'd like to point out my badge. It's a commercial fisheries emergency meeting by the MMF, SCO, and MKO. Anyway, diabetes is an epidemic in all of my First Nations. A major issue for those living in the North is being unable to receive treatment in their home communities. Many are sent south to receive treatment far away from loved ones and supports. That method is very expensive. My own brother, Riley Harper, lived in a hotel room for almost 3 years. I wish the government would do the math. At-home support networks can also help in the recovery process. What is this government doing to help those First Nations receive treatment close to home?
The Honourable Minister of Health, Seniors and Active Living.
I thank the member for the question, and I appreciate that comment about doing the math, because it is the framework for decision making for our government, an evidence-based decision making process, one that is not politicized but based on evidence and the outcome of patients.
Order.
And while I continue to be heckled by members on the other side who do not care about patient outcomes, we do. Madam Speaker, the member makes a good point. Every effort is being undertaken to address not only the challenge of the chronic disease epidemic that's clearly coming at our province, but to decide how we can best locate services and resources to serve people in their own communities.
The Honourable Member for Keewatin on a supplementary question.
Thank you. Berens River First Nation should be commended for their work to end the epidemic in their First Nation. Instead, this government pulled out their dialysis units from them without as much as a word to the Chief and Council nor to the nurses. In fact, when the nurses noticed the machines were missing, they thought they had been stolen. I know it's pointless to ask this PC government to stop the health cuts, but can they at least assure us that they will respect First Nation leaderships by making them aware of such drastic healthcare changes?
The Honourable Minister of Health, Seniors and Active Living.
Madam Speaker, here the member is less correct, decidedly. I can inform her that when it comes to Berens River, the leadership of the First Nation was notified 6 and 7 months in advance of the changes. That members should know that for a period of 6 and 7 months, there were no patients needing this service. The resources were relocated to be able to help more patients. In the meantime, though, the other consideration she fails to recognize is that not all patients can safely and effectually receive these kind of treatments in their own home. Sometimes it is more complex, and in those cases, those things need to be done in hospital.
Here.
The Honourable Member for Keewatin on a final supplementary.
Thank you. First Nations people have a history of not being consulted on major issues impacting our communities, and it does not surprise me that this government is continuing on that trend. Madam Speaker, Berens River was blindsided. Their nurses left in the dark without proper explanation until after the fact. Berens River Health Director has stated that the elders in our community who need and deserve to be home in their communities were close to being approved for treatment. When will Berens River have their dialysis units back in their community, and when will the renal center be up and running?
The Honourable Minister of Health, Seniors and Active Living.
Madam Speaker, I must inform that member that she is incorrect. I did look into this issue, and the community was not blindsided, that there were meetings, there was notification provided well in advance that on the basis of the lack of evidence that those resources would be redeployed in order to help a greater number of people. We are committed to renal resources for people in the North. I only wish I had more time to talk about the ways in which we're working in cooperation with others who are system leaders to be able to do more diagnostics and to be able to more effectually be able to help people with chronic disease get the services they need in their own communities. We'll continue to make that commitment.